Hi everybody, I'm DeLaney Gabriel and it's July 31st, 2019. I'm at my desk with Shelly, my assistant, who's brought some more lab test results to me that somebody sent to the office. So what you got?
We had a client fax in 5 pages of lab test results and wants to know your opinion on what they mean.
This is sounding so familiar because this person's been with me about 25 years and they tend to think that this is my crystal ball and think that I can just tell them what to do. But they also know it never works that way because I go over every single line on these, every test, every reference range, everything, and make them sit and listen while I expand on every test on there. This is kind of an idea about what I do for my clients. Like this person's been with me over 10 years and I have another one like this that's probably 4 feet wide because we do a lot of anti-aging kinds of things, which is my passion, and she gets all the lab tests that I like so that we can monitor and make sure everything's going well. So let's see, on this one, so I remember that I had written a letter to her so that she would know what to have her doctor run. Medical doctors typically don't go to the extent that I do in getting information from people from their blood, so that I have a kind of a whole body assessment for it. So I live and breathe by lab test results. And without them, I sometimes don't know what to do, and I sure don't like doing a lot of guesswork. So what I really want to focus here, because I've got a Lyme disease webinar in about 10 minutes. So I'm going to kind of cut to the chase here. Shelly, I really want to talk about the hormones that I'm looking at on here. But before I do that, a couple of things on this first page that are a part of the comprehensive metabolic panel really catch my eye, and they have to do with the immune system. So her white blood cells at 5.7, that's a really good number, but the neutrophils that have to do with infection and inflammation, number's way too high, and her lymphocytes that have to do with virus, that number's too low. So in your immune system, the neutrophils that have to do with infection, like I said, and inflammation, and the lymphocytes that have to do with virus. So with teeter-totters, if one's up, the other's down. That's the way it goes. So if your body is really, really busy fighting infection, then it produces the white blood cells that it needs to deal with that infection. So when this goes up, then the virus count goes down. And it could be that the person also has a virus, but the body is saying, like, red alert over here. I have all this infection or inflammation that I need to deal with. So it's an all-out alert to take care of that. So that's the first big issue that I see. Second one here on this first page is a test called BUN, blood urea nitrogen. And this number is 12 with a reference range of 8 to 22. So what I don't like about this number is that it shows that she is losing muscle and that her body is turning fat. So because I know things like that, that's kind of why my clients say that this is my crystal ball, because I can look at these numbers even without knowing anybody's age or anything about them. This just tells kind of its own story, and most of the time it matches. So anyway, what I would want her to do to get that number better would be to make sure that she eats enough protein. Let's see what her protein number is.
What is an optimal number for BUN?
Optimal number with a reference range here on this one from 12 to 22. Optimal would be like around 17, 18, so that you know that you're in it's 8 to 27, I'm sorry. So let me state that again. So with a reference range of 8 to 27, her number's at 12, but I'd still want it to be 17 to 18. Reference ranges on labs do change a little bit, but I still like a 17 to 18, kind of regardless of what that lab looks at. So how she would need to make that change is actually, her protein number is perfect, 7.2. That is ideal. So what it tells me is that she's getting enough protein, but she's not digesting it. So what I would recommend for that, since I know that she is a blood type O person, I would have her, and she may be taking my digest aid. She probably already is, but just, she's either not taking it or she's not taking it enough, because what's happening is that whatever protein is in her stomach and gets into her bloodstream, it's not being broken down. So she's not getting the muscle that she needs from her food. And then there's a test on here, alkaline phosphatase. Alkaline phosphatase, anytime you see a test that has ASE on the end of it, that's an enzyme. So what this enzyme is, it has to do with liver, but it's also, I call it a blood test for bones, because if the number is too high, that's when I see bone cancer in people. If it's really high, and especially if they've already been diagnosed with cancer, then it's a pretty good indication that that has metastasized to the bone. So with this number at 50, it's too low. So it means that she doesn't have either enough magnesium or the right kind of calcium. For blood type O, for calcium, I like a product called MCHC. It's one of my private labels. It's microcrystalline hydroxyapatite concentrate. And what that is, it's from veal bone. So I don't often recommend it for blood type A, but I do for blood type B. So I know it's on her list because she's been, like I say, it's on her optimum health protocol that I have for her. So whatever she's taking is not enough. So if she's taking the 3 a day that I've recommended, then she needs to be taking more. And then the other thing is, this is a good indication, again, about bone, of whether the vitamin D is a good level. And shoot. Oh, here it is, 80.3. So yes, that is a really good number with a reference range of 30 to 100. That's a really good number of vitamin D. So again, what this does, it tells me what's right and it tells me what's off. So we definitely need to increase her digestion, improve that, and get her to take higher dosages of the right kind of calcium and magnesium. Then iron, number's too high. Reference range for iron on here is 27 to 139. Her number's at 133. So I want to know where she's getting this iron. I'll ask her, for example, if she's cooking with an iron skillet, or if she's eating boxed cereal, which she better not be, but she might be. And the reason for that, and your kids could even do it, or you could do it as an experiment. You just take whatever's in your cereal. If it's fortified with iron, it's not a food quality kind of iron, it's a metal kind of iron. So what you can do is you can put it even like under some saran wrap or plastic or something, just crunch some of them up really fine, and then take a magnet and you can move it and you'll find out what kind of iron is really in your cereal.
Oh my gosh.
Yeah, that's true. That's true. My little granddaughter did that as an experiment for her class. Everybody was pretty impressed. So we need to know what kind of iron this is and get that down. Another thing to do for high iron is vitamin C, because vitamin C is sort of a natural chelator for iron. And what chelate means, it means to break down. So we can work on that. And then we get to the good stuff on hormones, which I'm crazy about. So the top hormone, besides growth hormone, is pregnenolone. So the reference range for pregnenolone typically on labs is, they want you to be under 150, but I'm not necessarily in agreement in that for everybody. But her level here is 67, which is just, it's way too low, and it's especially way too low for her age. And speaking of that, labs grade on the curve. So the older you get, the reference range changes. So it has little to do with optimal health and just kind of pass or fail. In this case, I would give her like a D, because I'd like pregnenolone levels to be around 150. I also like DHEA sulfate levels to be around 150. So with her DHEA sulfate, she's at 194. I know she's taking my DHEA 50 milligrams. I had her taking one twice a day, so what I'm going to do based on this information is I'm going to cut down on the DHEA, have her just take one a day, and then I'm going to increase her pregnenolone. Because pregnenolone is what's called the up-chain hormone. That has to do with your brain, your memory, and so forth. So it's important that the pregnenolone level be good. And then just as a note, DHEA has everything to do with your adrenal glands. Adrenal. It means they sit back here above the kidneys. So this DHEA number can also be high if somebody's under a lot of what I call prolonged undue stress, because the adrenal glands are having to kick it out. In my field of anti-aging, DHEA is known as the fountain of youth. But this indicates that for whatever reason her number is too high. It can be because she's taking a very quality product, which I know mine is, or it could be that she's under a lot of stress. I won't know until I talk with her about that. Then we get to some TSH, and this looks a lot like, Shelley, this looks like a lot of the same number that I just discussed on that other video that we just did. So almost the same thing. So if you'll refer to my video that same date that's on thyroid, it'll give you some information about that. Okay, so back to hormones, and I know we're moving along here. So pregnenolone's the top hormone, then DHEA, and then after that I want to know what the testosterone level is, and her testosterone level, I'm sure they ran it, yeah, testosterone level is 30.9 on a reference range of 70 to 40. And this is a gal who's well into her 60s, and so it lets me know the testosterone I have her on is working. That's a great number. I wouldn't change it for any reason unless she tells me that she has symptoms that are making her aggressive and mouthing off at her husband, things like that, or if it's too low and she doesn't have a sex drive or she's tired or whatever. Then let's talk primary hormones. So progesterone is, this is not good, 0.5. And the reason I shuddered there is because her estrone number is 95 and her estradiol number is 78.2. So this is just not good. So how it works, there are 3 major hormones to deal with females and men too, and it's the progesterone like I talked about. And then there are 2 estrogens, estrone, E-S-T-R-O-N-E, the 1, and estradiol, D-I, for 2. So there should be 2 parts of estradiol. So if her estradiol here at 78, if it should be a 2-to-1 ratio, then her estrone should only be 39, if I did my math right, and I think I did. So I love the estradiol number for her age and for what she's doing, but the estrone number is still too high. I know that I have recommended my DIM and curcumin for her, and that's what I would stick with on this. I would just increase the dosage. The reason I would use the DIM with the curcumin in it is because she has that inflammation from the neutrophils. If that wasn't there, then I would increase just her DIM and calcium diglucarate. So those are the 2 that I use. Calcium diglucarate is an aromatase inhibitor, and what that means is that it breaks down estrogens, the bad estrogens, the overabundance of estrogens in the blood. And so that's what I use in my practice instead of tamoxifen and things that are typically used in medicine. And I even use the calcium diglucarate and the DIM and curcumin in I don't call them patients or cancer patients, and I'd say in the people I treat who've been diagnosed with an abundance of cancer cells. So we've got to get that corrected. So the goal would be to keep this estradiol at 78, but break that estrone down at least 50%. and then to increase her progesterone, because we have to look at the total estrogens. We kind of have to add those up. And then progesterone needs to be in a good balance to that. So with where her hormones are here and based on her age, her progesterone really should be, 4.5 or 6.5, but I really don't like for it to have to be that high. But what I'm going to strive for here is somewhere between 1.5 and 2.5. So that's the take on that, and all I have time for right now. So I hope this has been helpful for you. I hope you can take a look at your own blood tests and get a sense of how I work in doing your spreadsheet. You can do those yourself and monitor your hormones. Again, the hormone levels really are important, but you can't treat just on hormone blood tests alone. We have to look at your symptoms. We have to consider everything and make the best choices, and then these need to be monitored. And what I'll want her to do is I want her to be on a different treatment program for about 3 months. Then I'll want her doctor to specifically order these things which are out of balance. So thanks for listening. I hope you learned something. I know sometimes I talk really fast, so I just ask that you listen really fast or play it again for the things that really are reflective of your health or meet your health needs. So thank you again. And Shelly's telling me you can check this out also on DeLaneyGabriel.com. That's where I have all the amazing supplements that I have that are from really good family-owned companies. They're not from the Clorox company or Schwab or Pfizer. I don't use a lot of products that come from that are owned by the Nestle company and others like that. So just good things for good people. Thanks again for watching. Bye for now.